Hello, Dr. Dilip Gude here, physician, Somajigoda Yashoda Hospital. We'll discuss about acid peptic disease in today's discussion. So, acid peptic disease can range from a simple, erosion or just redness of the mucosa on one side, on one hand, to a proper bleeding ulcer on the other hand. So, this is a spectrum of acid peptic disease. And one of the offshoot is GERD, that is gastroesophageal reflux disease. That means that the acidic content in the stomach is actually going up. It's supposed to go down towards the duodenum, but when you have a lax lower esophageal sphincter, sphincter is nothing but a muscle basically which constricts and does not allow the acidic content to go up. But when people are obese, when they are they have their BMI is high, they are overweight. In that case, usually this LES, lower esophageal sphincter tone comes down, and then it is not so tight anymore. So since it starts getting loose, the acidic content of the stomach starts going up, and that causes gastroesophageal reflux disease. Now, this esophageal reflux increases when one lies down completely without a pillow, because the stomach contents can easily go higher up and cause because esophageal lining is actually not suited for acidic content. So the esophageal lining can get very red and then inflamed, as in swollen, and then it can actually lead to a condition called Barrett's esophagus, which is nothing but a pre-cancer kind of a situation. In which case, if you don't treat it well, if you don't address it well, then long-standing Barrett's esophagus can actually cause esophageal cancer. So we need to be we need to understand that acidity or gas that people keep complaining about is not really a small symptom. Sometimes people who have diabetes, they may think that their burps or the kind of heartburn that they're getting may be all from acidic or acid peptic disease. But rarely it can actually be a symptom of coronary artery disease, that is heart disease basically. So once you rule out that there is no heart disease in this particular diabetic patient, you might need to do an endoscopy. We all know that endoscopy is nothing but a wire with a camera, and which actually goes down and looks at the esophagus, the pipe, the food pipe, and then the stomach as well. So how bad is the condition? Is it just erosive gastritis? Is it only the redness, inflamed mucosa, or on the other hand, is there an active bleeding ulcer present or not? So it can range from any of these spectrums. So when there is an active ulcer, not one, sometimes there will be 2 or 3 ulcers, gastric ulcers, sometimes even duodenal ulcers are also present. So in which case, the people get a severe pain, especially when they eat. So gastric ulcers usually have increased pain when people eat, because acid secretion increases when stomach has contents when people swallow food. So that is typical of a gastric ulcer, while getting pain after usually an hour or so usually denotes that there may be a duodenal ulcer. But regardless, we need to do an endoscopy to confirm the kind of ulcer patient has, the degree of ulcer. Is it a pre-ulcer stage? Can it be treated early on? Is it rapid urease test positive or not? Now, rapid urease test is nothing but a test that reflects if there is a presence of a bacteria called Helicobacter pylori. H. pylori is nothing but a bacteria which increases the gastrin or acid secretion in the stomach. So if H. pylori is present, you might need to be given a HP kit, as in Helicobacter pylori erasing or killing kit, which contains proton pump inhibitors which decrease the acid secretion, and which also has 2 antibiotics which kill the bacteria. So that needs to be taken morning and night for at least 14 days, which is when you kill the H. pylori bacteria, and that's when you decrease the gastrin of the stomach, and then acid content also comes down. So do not take acidity symptoms, gas symptoms lightly. Please get evaluated if it is chronic, if it is more than 2 to 3 weeks, and try to see the kind of foods that you need to avoid, especially if you have acid peptic disease. Avoid anything hot, basically. Be it tea, coffee, or milk, or anything, even water. Sometimes people tend to have hot water in the morning and all. So hot water is not really recommended, especially for those who have acid peptic disease. So avoid masala foods, then oily foods, then chocolates. All these tend to decrease the tone of the lower esophageal sphincter, and then it starts becoming loose and not so tight, and then the contents of the stomach actually go higher up and cause acidity related damage to the esophagus and also to the stomach. So please get evaluated about your acid peptic disease and try to know where you stand in the spectrum of the disease. Thank you.